Hey y'all, welcome back to episode 7 of the Mill Spill, where I'm talking about stretching. So, it's a big topic, a lot to cover, and a lot of opinions that are out there on stretching good, bad, indifferent, otherwise. I'm going to give you my thoughts, what I do as a clinician, what I see in the clinic, when it's appropriate, when it's not, and kind of strategies to look for as a client, patient, person, if you fit the category for stretching or some other type of therapy or intervention. So, first, let me tell you what I do. I don't give stretching. I don't give it at all. I don't do it. I don't prescribe it because in 95% of the cases that I see, stretching is when I test the muscle length. And if you don't know how, you need to as a therapist. If you test muscle length, a lot of times it's not something that is significant. There are cases where I get what's called adaptive shortening. So that's if someone has had, let's take a look at the hamstring, right? Someone's had like a knee dysfunction, they've got bad arthritic change in the knee, and it doesn't go straight. So over a long period of time, that bent knee position, the muscle will adapt to that and actually get shorter. So a lot of times these patients have knee replacements and they come and they truly, their muscle is shorter. And especially the hamstring in particular, that is something that needs to be addressed. And we'll talk about dosage and stretching and kind of what I do in those situations. But I think it's better to understand why stretching is not appropriate. So the key component here is testing. So you have to know as a therapist and as a patient, you have to be educated on whether it is the muscle or a nerve, which a lot of the times it is, especially the hamstring, or if you are feeling tight all the time, it could be that you have joint stiffness. So let's take example, that same hamstring muscle, right? So you can do a test in the clinic where we see, it's called a straight leg raise test for hamstring length, right? I like it between 70 and 90 degrees. That's pretty much standard and normal. But if it's less than that and you're not teasing out the fact that it's a nerve, then you may prescribe a hamstring stretch for someone that doesn't need it. And here's the problem when you do that. If you give them a hamstring stretch, it could actually irritate the sciatic nerve. And it could result in something known as latency, where during the day they're fine, but they go to sleep at night and all of a sudden they feel just tremendous stiffness, tightness, soreness in the back of their leg, and they think it's their hamstring. Well, in fact, you could have potentially irritated that sciatic nerve by giving a hamstring stretch. So it's very important to be able to tease out whether it is a muscle shortening, if it's true, or if it's nerve tension, and you have to address that with specific exercises and nerve stretching. I do believe in that. Or they call them lengtheners, tensioners, glides, slides, whatever you want to call it. It's still affecting the nerve, not the muscle. And or if it's a joint restriction, whether, let's take that hamstring, whether it's at the hip or the knee, that's restricting the actual mechanics of the joint. So those are things that have to be ruled out in order for you to determine if stretching is good for you. Okay. So on the length, on the side of the nerve, nerves are very similar to muscles. They can act like them. It can feel like pulling, stretching. It'd be painful. It can go down the back of the leg. It can go into the knee. It can go into the hip. But nerves are like muscles. They do need to be stretched, and it's appropriate to give nerve tensioning, stretching, whatever, in those cases. And that will have way more an effect on you than actually doing a static hamstring stretch. In regards to hamstring stretching, or really any muscle that you test that is true, you've ruled out nerve, you ruled out joint, and it's true muscle adaptive shortening, then I'll prescribe stretching, and that is 20 minutes with heat, just statically sitting on it. And you do that a couple times a day. So it is a lengthy process and it doesn't change very much. So the results are very long-term in nature, and they take a long time to truly lengthen that tissue, because you may have spent 20 years with your knee bent and the muscle is shortened. So think about that with stretching. Okay, so that's nerve, and that's the reason why I would prescribe stretching. Now let's talk about people who always feel like they're tight, okay, and they need to stretch. They love to stretch, and it feels so good. And typically, these are people who are flexible in general. They're fit, they're athletic, younger population, but all you can go up into 50s, 60s, 70s and still have this same sensation. What you're feeling is not muscle tension at all. In my opinion, and what I've seen in my history as a therapist, is that it is actually a result of hypermobility. There are certain signs and symptoms that patients have who have hypermobility. And I always tell them they're like Gumby. So if you're one of these ladies or gentlemen who are all loosey goosey and just kind of always feel like they need to move and stretch and cannot sit still for any length of time without feeling antsy or tolerate just standing still or laying down, constantly moving, constantly shifting, changing positions. You're better on the move. This is a population of people who, if they do yoga type movements, they get relief because the body interprets the stretch as a short term analgesic kind of sympathetic nervous system response. So you get the euphoric feeling from stretching. The problem with that is that if you don't address the underlying hypermobility, and a lot of times it's in the spine, but it could be elsewhere, then all you're doing is creating a situation where you feel like you just need to stretch more and more and more and constantly, constant. And that's why people like yoga and things like that. Now, to be fair, yoga also has a lot of balance, coordination, stability exercise. And a lot of times these patients don't do well with that, so they have to modify it. But they love the stretching. That's why it's funny. Stretching clinics have actually become popular because people love stretching so much, when in fact it could be very detrimental. And in the clinic, and in my personal life, if I ever feel the need to, if I have these symptoms of a hypermobility, which is way more common than what people think, then anytime I tell people that they feel like they need to stretch or self manipulate or do whatever to get relief short term, they need to strengthen. And if they don't know what to strengthen, that's why you invest in yourself. Get a practitioner, professional who can identify if you fit into this category, if you feel like you need to stretch all the time or to get short-term relief, but you still have like that tension, that feeling that you just need to, you can't quite get what you want. In my opinion and what I've seen, if you address that hypermobility, and there's a lot of you guys out there, then you will not get the relief. That's why my big thing with patients who have that is that I love Pilates much better because they do a lot more stabilization exercise and strengthening versus stretching. So I think that is the side that I lean a little bit more toward. But again, if you have questions, if this is you, please don't hesitate. Reach out, text me, or send me a message, or hit me up with an email at info@powermillperformance.com, and I'd be happy to answer and put you into kind of our symptom algorithm to let you know if you fit this hypermobility. So the last thing I'll leave you with is that I think there's two kinds of people. Okay, there's a perfect kind of person, and that's your gymnast, your dancer, your skater, flexible and strong. Okay, then you have the other type of person. You have a person that fits into a category of you're either strong but not flexible, okay, which leads to problems, or you're super flexible and not strong. And we see both. I would argue way more sit on this side. So a lot of times that's something that takes a long time to educate, learn. So please, if you feel like you fit into those categories, we're not all gymnasts, we're not all dancers, we're not all ice skaters. So if you have issues, stiffness, soreness, pain, let me know. I'm here to help, and look out for more, guys. I know this is a controversial topic, but I'm not about stretching. Let's strengthen you up. Let's get you out there. Thanks.